Good morning, and thank you so much for joining us here for We Should Talk About It. I'm Myra Ansari with Dr. Stephen Taylor from UofL Health Peace Hospital. And today we're talking about something that I wanted to open the conversation about because I've had a very good friend of mine lose her partner suddenly. And it just has sparked so many emotions. And the biggest one is shock because it was an unexpected death. And it's been so hard to process because this person was picture of healthy. So it's just kind of hard to wrap our brains around this type of loss that's sudden. Maybe you all are experiencing that if you've lost someone that you were not prepared. I don't think anyone is ever prepared to lose someone, but when you lose someone, say, to an act of violence or an accident or a sudden health issue, it's hard to process. It's different compared to,
absolutely.
I know that you are sick and it's time.
Right. Yeah, absolutely. I mean, loss and grief and death are such huge topics and such, I mean, they're a facet of life. It's a part of our everyday lives, but it's just very hard for us to experience and process it and to deal with it. As you were talking, I was thinking of this movie. You remember the actor Tim Curry, the actor who was in what's that famous?
I'm not sure.
It's like my mind is going blank. Rocky Horror Picture Show.
Okay.
Right. So he was the one that was like the main character in that, right?
Okay.
So anyway, he was in another movie, and he and his wife have gotten, they're going to get divorced, but she can't tell her family they're going to get divorced. So they have to pretend like they're still together. They go to this family. It's a group that's awake, and she's like, just make small talk, and he's terrible at it. And he says, the first words he says are death, the great equalizer. And she's thinking a little smaller.
Yes.
And, death is a hard topic for us to have a conversation about. It's just very, very difficult for us to cover it and to approach it. It's very painful. Grief is a terrible thing for us to experience, but it's something we all experience. But like you were saying at the beginning with a friend of yours who just suddenly loses somebody, it's such a huge shock. Nobody prepares for that. It's one thing to have somebody who's sick and we can prepare for it. It's another thing to lose somebody just out of the blue, somebody especially that we think is healthy.
Exactly. And, Dr. Taylor, you brought up a good point. When someone, say, is ill and they're in pain, oftentimes we think when they pass, okay, they're in a better place, right? They're no longer in pain. It can also be a sense of relief, not to sound crude or anything or heartless, but if you know someone's hurting, you kind of know, okay, the pain is over for them. And
you can feel some relief. The thing about loss and death and grief is it's such a complicated emotional experience. There's a lot that we feel when we lose somebody, and it's important to make space for all those feelings. There is the pain of the loss. There is the hurt. There is the loneliness. There is the isolation that we feel. There can be relief. That can be part of what we feel, and we can feel very guilty about that feeling, like we're not supposed to feel that or we're bad people for feeling that way. But those are all parts of grief. It's all part of the bereavement. It's all part of what we as human beings experience. And we need to allow it, at the very least, allow ourselves room to experience all those feelings.
And, losing someone, if you've lost someone and you want to share something about your loved one, please share it in our comments, maybe how I've dealt with it, maybe a positive thing about your loved one. Would love to give you this opportunity to maybe let out some of those feelings, because it is important, and I told my friend, it's going to be okay, but it's okay if it's not okay,
Right. Yeah.
It's okay if you don't feel okay.
And you're talking about making space for feelings too. That's so important. Make space for yourself to have your own feelings. But if you want to think, what can I do for somebody who's lost someone? Making space for them is a big thing we can do. Give them room to feel what they feel and talk about what they talk about, or give them room not to say anything and be able to be in that room with them. That's important.
And that's one of the questions I asked Dr. Taylor this morning when we were just sitting and chatting, because I was telling him, I was like, I just didn't know what to say to her. And, she's a good friend of mine. And I wanted to say something that was meaningful, that would help her. Right. And nothing was like coming out of my mouth or my brain. And I felt so bad afterwards. I was like, why didn't I say something that mattered?
Well, being there mattered. And that's what we need to keep in mind. Our just being there is what matters. We get this feeling that sometimes we're supposed to be like the Hollywood movie and do this great soliloquy and have this wonderful speech that sort of encapsulates life and brings it all together. And then the violins start playing and then there's a fade to the sunrise or something. That's very Hollywood, but it's not the way the world really is. It's not the way experience really is. Just being there is what matters. And it's the little things that we do that add up to make something big.
How much of when dealing with sudden loss, like the emotions that we feel, I would think that every emotion is a valid emotion, but what are some of the common feelings? Like if you're trying to understand what someone's going through right now, what are some things that we should remind ourselves what people are feeling?
Well, there's going to be anger for the loss. There's going to be shock. There's going to be feeling pretty numb at first and just not knowing that they are feeling anything. And, I think we can make it worse by saying, well, tell me what you're feeling. They may not know what they feel at that moment, and feeling angry, feeling hurt, feeling lost, feeling like they can't make it. Like, how do they go? How do they go forward? How are they going to pay their bills? How are they going to make it through life? There's so many feelings that can be flooding their mind at the beginning, and just to give them space to process it and to be available as a listener to help them process it. I think that's important.
I think one of the other feelings that people feel when they've suddenly lost somebody is guilt, right?
For sure.
I could have done something.
I should have been there. Right. As if somehow the whole world will be different if you did something different. It's part of the grieving process. We think of grieving as a sort of a staged process, which is a little true and untrue at the same time. I mean, we do get angry. It's part of grieving. We do bargain. That's part of what we do when we grieve. We do feel some denial. That's part of what we experience when we grieve. We do have some acceptance. That is part of grieving. We do move on. That is part of grieving, but we don't do those in steps. That's not something that happens in a stepwise fashion.
How does it happen?
It's all at once. There are going to be moments when we think that door's going to open, then they're going to come through the doorway. At the same time, we're just angry about it all. At the same time, we're thinking, I'll be a better person. I'll do this if only that. We do a lot of bargaining. We do it all at the same time. It's not like, oh, I'm in the bargaining phase, so this is the period where I'm going to be like making deals with God to make it go away. Oh, now I'm in the anger phase. This is the part where I'm just going to be angry all the time.
It can go from one feeling to the other. Suddenly.
Yeah, absolutely. It's like being in the middle of a tornado.
Sure. And sometimes that person may be laughing, remembering something, or I notice like when we're all sitting there trying to make that person feel better, 1 minute we can be laughing and then 1 minute it's dead silence.
Right.
And it's just, you're right. I didn't think about it that way, that it can be all of it.
It's all at once.
All at once.
Yeah. What was that movie, Everything, Everywhere, All at Once, or something like that? It's kind of like that. It's all happening all at one time. So we feel it all that way, for sure.
When folks come to you who deal with sudden loss, what's something that you tell them, Dr. Taylor? What's something that is a common thing that you feel that your patients say to you?
Yeah, I mean, part of it is what we're talking about here, making room for you to have your feelings, whatever they are, and that there isn't a proper way you're supposed to have your feelings. Your feelings are what you feel, and talking about it and making room for it is what's important. I think sometimes people have this fear of losing the memory of the person they lost. And that somehow holding on to the grief is a way of holding on to the person. And it can also be a way of keeping them from continuing to live their lives. Because one of the tragic realities of grief is that grief is the recognition that you are living your life in the absence of somebody that you've lost.
Yeah.
And that is part of what grief is.
We have a question here from a viewer, Nancy Spencer. She said, we just lost a 21-year-old grandson. Nancy, I am so incredibly sorry for your loss. I'm sure that has to be devastating for you. She said, everyone is lost. How do we comfort one another without stepping out of boundaries? That's a good question.
Yeah, I mean, there's so much in there. Yeah, Nancy, I share that. I share that tragedy. That's a terrible loss, and I am so very sorry for that loss. She asked a question about how do you
comfort one another without stepping out of boundaries?
Yeah, I mean, there's so much to unpack in that. I'm not sure, what Nancy's thoughts are there or what the stepping out of boundaries might represent. But being close and being available to each other is important. You can't force someone else to process their grief. Maybe that's part of what she's talking about with the boundaries.
And you can't force someone to process the way you process.
That's definitely true. Everybody's going to do it differently. It's good. It's an individual process for individuals. It's not a sort of blanket thing that we sort of all do the same way.
And Nancy, I don't know if this will help with your question, but I sometimes wonder, how do you help that person move forward, go out and do things like eat, do things like going outside, do things like the basic things that we need you to, you need to do to function.
Yeah. And what you're kind of talking about is taking care of yourself.
Yeah.
How do you begin to take care of yourself again? And it's hard to put the focus on yourself when you lose something and it's so tragic. The loss of a 21-year-old is a tragedy.
Very much. Yeah.
The loss of anyone is a tragedy, but to lose someone so young is very, very painful. And I think it's one of those things where you are the encourager. And I think, how
do you do that without being pushy, without annoying the person? Like, say, did you eat? Can I get you something to eat? I know that everybody has brought you all this food, but I need you to eat. I need you to eat a little something without being so like.
Without being like, you don't want to grab the spoon and say, here, eat this.
Yes, exactly.
Put this in your mouth and eat it.
Go, please take a shower. It'll help you feel better. Just little things like that.
Well, and I think little things is the key, encouraging the little things. You're not saying, okay, let's clean the house and get rid of all the stuff and move on. That's a pretty big thing. Yeah, but brush your hair, or let me brush your hair if that's the way the friendship is, or take a shower. Yeah, brush your teeth. Something that's small and doesn't require a lot of effort to sort of engage in self-care and begin to get self-care to be a piece of it. That is important. It is important for us to take care of ourselves, but it can feel overwhelming. Small things are much easier. Here's a roll.
Yeah.
You don't have to eat this whole plate of food, but
just take a bite.
Take a bite.
Take a bite.
Yeah.
And I understand that, because that's, Nancy, I do hope that we answered your question. If we didn't, please ask for some clarity and maybe we can help you, because I know how that feels. Like when you want someone, you just want to make sure they're okay. And, when someone's dealing with grief, they may not be thinking about themselves. They may not, they're not sleeping well. They're not eating. They're not doing the things that drinking water, doing, just things that they need to do.
Right. And you can do some of those things to help. If there's a laundry basket full of laundry, you can go wash their clothes. I don't think that they're going to say, stop doing that. But that's helpful. That makes the place feel different. And those things can be helpful.
Yeah.
Help pick up the dishes after the wake or something like that. Those are all things that mean a lot.
I know we were talking about this, just the simple fact of being there for your person, that you don't have to say sometimes something. If they want to say something, you just listen. And
just be there. It's okay to be there. You're not there to make it better. How are you going to make it better? Right.
Don't we all want to do that?
We do. Of course, we want that to happen. But our job is not to erase the pain. Our job is to be with them and to let them know that we're there with them. That's important.
This is going to sound like a very stupid question, but and everybody is different, but at what point do you after you've lost something, and it is such a tragic loss, such a sudden loss, is I don't want to say appropriate, because I don't, but like, at what point do you just start to pick up and move forward?
I mean, that's an answer that everyone answers for themselves. You know, when do you pick up and go? When do you start moving forward? It's so individual and so much a part of each person's experience.
Mm-hmm.
I mean, I guess I would say, you just know when you know.
Mm-hmm.
And we can
Is there guilt with that?
I think for sure. Because, like, again, the grief, the bereavement, the grieving is living your life in the absence of having someone with you.
Mm-hmm.
And so that is moving on.
Mm-hmm.
You know, the moving on is painful.
It is painful.
But it is a part of the grieving process.
And I think another aspect of all of this that we didn't talk about is that, losing someone at any time is hard. But you losing someone around the holidays is really, really hard. That has to be a little tougher. Nancy wrote, blame is a big part of this.
Mm-hmm.
Dad found him. My daughter, his mom is so torn. Yeah. I'm so sorry, Nancy. Yeah. I know that's got to be so tough.
There's so much pain in that.
Yeah.
Yeah, for sure. Yeah, blame. It's right, because who are we going to... Somebody did this. Somebody has to have done this to us. Mm-hmm. And so to find some place to blame, someone to blame, is a way of dispelling all that.
Or why didn't I do this? Is my fault. Right. You blame yourself. Yeah. Like, why didn't I push so-and-so to go to the doctor? Yeah. Why didn't I check out the car? Right. Why did I tell him to go to the store for me? Exactly. When this happened? Exactly. Yeah. There's so many things.
It's my fault. It's your fault, or somebody else did this. Mm-hmm. Blame can be a way of trying to dispel our own feelings about it and remove the intensity of it. Mm-hmm. And I think it's important not to blame anybody. Mm-hmm. To be able to tolerate holding the feelings for ourselves helps our other people mm-hmm. tolerate it for themselves. So if you're with a friend and you don't know what to say, well, part of what you're doing that's so helpful is you're holding the feelings too, mm-hmm. and you're not finding someone dependent on.
Mm-hmm. I think another thing is, what would my loved one want me to do? Mm. Would they want mm-hmm. me to sit here and let myself go into a deep depression?
Right.
Would they want me to smile when I say their name? Would they want me to remember the happy things?
Sure.
How much of that can help us get up and move?
Well, it helps us hold on to them for ourselves in a way, right? We're keeping them with us. And there's some comfort in knowing that we aren't letting go of them, even though we're moving on, that we're not forgetting about them or forgetting who they are. And part of remembering who they are is remembering who they really were as people. And, if the person really was somebody who liked to make jokes and wanted you to laugh and wanted you to be happy, then that part of that person stays with you too. Mm-hmm. That's what they would want. Mm-hmm. Mm-hmm. It's much more complicated, I imagine, and I think is true, if it's somebody with whom you had a very difficult, strained relationship and then you lose them. Mm-hmm. I think there's a different kind of grief and a different kind of pain in that.
That's true.
If there was sort of something incomplete in the relationship and something was broken in it, that makes it very difficult to let go of and to move on.
Yeah.
Because they weren't really a complete person in your mind. And I think that makes that a very challenging thing. But if you had a kind of a full relationship with the person, it does make it a little bit easier. Not that it ever is easy, but it does make it less painful if you can hold on to the good parts of them too at the same time.
How do you go through the holidays?
It's not easy. You imagine the holiday table with the empty chair. How does one process that? It's very difficult to move into a family gathering where somebody isn't with you. I think it's important for everyone there to remember that we need space for that lost person, to think about them, to remember them, to grieve them in the presence of all the other things that we're doing. There could be children and children's children there that are exciting and fun and playful, and we can enjoy that. But I think there needs to be room for us still to hold on to the pain of the loss and not try to sweep it under the rug. Mm. It's going to be there.
It's going to be there.
Yeah. So we don't want it to turn into one of those tragic plays where family members are climbing over the table to attack each other because we can't process the feelings in any other way.
Yeah. How important is it to, okay, Nancy has another question. Nancy, I appreciate everything that you're putting out here because I think there are probably a lot of people in your boat. So you're very brave and I appreciate you asking these questions. She says, how do I help his 9-year-old brother cope? He says he can't focus on anything but his brother. That's a good question.
It is a good question. And I think making room for the 9-year-old to feel his feelings and talk about them.
Yeah. Because for a 9-year-old to wrap their brain around,
it's a lot.
That's a lot.
Yeah. I mean, you help him by listening and being there for him. You know, you can't answer his questions and make him not think about it anymore, but you can be there and hear him and hear what he's saying and meet him where he's at. That's all you can do.
Yeah.
And the pain's going to be there. It's going to hurt.
Gosh, I feel like, Dr. Taylor, we could talk about this forever because this is something that a lot of folks are going through.
Well, that's what we all go through.
Yeah.
You know, it's a part of our lives. It's a part of life. It's a tragedy when it's somebody so young, as in Nancy's case. But death is something that we all deal with. It's a part of who we are. It's hard to let the conversation go because we all want to make everyone feel better. That's what we want. We want to make that happen. But with grief and loss, you can't make it go away. You can't just make it feel better, but it can feel better by allowing space for people to talk and feel and express what's going on with them and to hear them and understand what they're saying.
Is a big no-no? I know that sounds kind of silly, but anything you should not do?
Yeah, don't tell parents they can just have another kid. That is not a good thing to do.
Yeah, that is not a good thing. No.
Don't tell everybody that, oh, it'll be better tomorrow. I mean, may or may not. And don't make promises you can't keep. You can't, I'm going to make this better for you. Well, maybe in some ways, but you can't make it go away. And so I think the main thing is to keep in mind that we can't make the feeling go away for ourselves or for the people who are suffering the loss. And the best thing we can be is to be there.
Yeah. Don't tell somebody else that they'll find somebody else, like if they were deeply in love with this person, you're still young, you'll find someone else.
Right.
I've heard that before. And it's just like, oh my God, why would you say that?
Right. Which on a very fundamental level may be true.
Yes.
But it's not where we are right now.
Yeah.
That's not where we are in this moment. So let's not try to get away from it. And I think the tendency for someone to say, oh, you'll find someone else, it'll be a brighter day, is a way of them not wanting to hold on to the feeling. And so part of what we do, I think that's the most important thing we can do for the people who are grieving, is to be able to tolerate the feeling with them and stay in it with them.
You
that's
hit it right there.
Yeah.
Is allowing, I think that, that makes me, because feeling it with them.
Yeah, we got to stay in it. And if we can stay in it with them, that's the biggest help we can be for them.
Yeah. Yeah.
That's the most we can do.
Okay. Dr. Taylor, is there anything I did not ask you?
Well, I would reiterate that. Stay with them. Stay with the feeling and don't let it go. And that's the most we can do to help.
All right. So, thank you, Nancy. She said, thank you. God is great. We are, the chances that this what are the chances that this came today? Nancy, I am so glad that we were there for you. And I pray for your family. And I, again, so sorry about this horrible loss for you. And I know there's a lot of people feeling those feelings right now. And it's very hard. And I think, like you said, Dr. Taylor, we just want to be there to help one another, make it all go away. But you brought up so many good points today that you can't make some of the things go away, but you can just be there for that person.
That's right.
Yep.
Yeah.
All right. Always love talking to you.
Yeah, you too.
And thank you for helping me right now.
Well, I'm glad.
Okay. All right. I'm Myra Ansari with Dr. Stephen Taylor. Have a wonderful day.